Why is modified ultrafiltration, MUF, particularly useful in pediatric cardiac surgery? A. It increases plasma oncotic pressure. B. It reduces postoperative pulmonary edema. C. It allows for faster cooling. D. It shortens bypass time. Answer: B. It reduces postoperative pulmonary edema. Explanation: MUF removes excess fluid and inflammatory mediators after CPB, which helps decrease pulmonary edema and improves cardiac and respiratory function, particularly critical in children. Which practice helps reduce the priming volume in CPB circuits? A. Use of long, wide-bore tubing. B. Miniaturized extracorporeal circuits. C. Open venous reservoirs. D. Larger oxygenators. Answer: B. Miniaturized extracorporeal circuits. Explanation: Mini circuits are designed with smaller tubing and smaller reservoirs to reduce priming volumes, thereby limiting hemodilution and preserving hematocrit. What is the primary composition of a typical CPB prime? A. 100% whole blood. B. 100% colloid solutions. C. Crystalloids plus or minus colloids plus or minus red blood cells. D. Fresh frozen plasma. Answer: C. Crystalloids plus or minus colloids plus or minus red blood cells. Explanation: Most CPB circuits are primed with a crystalloid base, e.g., saline or lactated ringers, often supplemented with colloids, e.g., albumin, and sometimes packed red blood cells to optimize the patient's hematocrit. What happens to blood viscosity during CPB hemodilution? A. It increases. B. It decreases. C. It remains the same. D. It fluctuates randomly. Answer: B. It decreases. Explanation: Hemodilution lowers hematocrit, which decreases blood viscosity, facilitating easier blood flow through the CPB circuit but at the cost of reduced oxygen carrying capacity. Which is a late complication of severe intraoperative hemodilution? A. Hyperkalemia. B. Hypoxia due to reduced oxygen carrying capacity. C. Hypertension. D. Thrombocytosis. Answer: B. Hypoxia due to reduced oxygen carrying capacity. Explanation: Excessive hemodilution reduces red blood cells, lowering the oxygen delivery to tissues, potentially leading to tissue hypoxia and lactic acidosis if not corrected. Which of the following best describes the main risk of excessive ultrafiltration during CPB? A. Hypervolemia. B. Hemoconcentration and hypovolemia. C. Coagulopathy improvement. D. Hemodilution. Answer: B. Hemoconcentration and hypovolemia. Explanation: Overaggressive ultrafiltration can remove too much plasma water, causing intravascular volume depletion, hypovolemia, and hemoconcentration, which can impair perfusion. Retrograde autologous priming, RAP, mainly involves A. Flushing the circuit with saline. B. Replacing circuit priming fluid with the patient's blood. C. Administering packed red cells into the patient before CPB. D. Removing plasma from the blood. Answer: B. Replacing circuit priming fluid with the patient's blood. Explanation: In RAP, blood from the patient is allowed to displace the crystalloid prime in the circuit, reducing hemodilution and maintaining a higher hematocrit at the start of CPB. Which of the following blood components is least preserved by standard cell salvage systems? A. Red blood cells. B. Platelets. C. Hemoglobin. D. Hematocrit. Answer: B. Platelets. Explanation: Cell salvage mainly concentrates red blood cells. Platelets are lost during the washing process, meaning they are not well preserved by standard salvagers. When performing acute normovolemic hemodilution, ANH, how is the patient's volume maintained after blood withdrawal? A. By transfusing fresh frozen plasma. B. By giving crystalloid or colloid solutions. C. By infusing packed red blood cells. D. By administering vasopressors. Answer: By giving crystalloid or colloid solutions. Explanation: after drawing blood for ANH, the patient's blood volume is maintained with crystalloid or colloid infusions to preserve cardiac output and tissue perfusion. In patients undergoing CPB, antifibrinolytic agents help to A. Increase clot breakdown. B. Decrease platelet adhesion. C. Stabilize fibrin clots and reduce bleeding. D. Promote systemic inflammation. Answer: C. Stabilize fibrin clots and reduce bleeding. Explanation: antifibrinolytics, e.g., tranexamic acid, inhibit plasminogen activation, stabilizing fibrin clots and reducing surgical blood loss and transfusion needs.